Hello and welcome to this short webinar on Florida's Medicaid coverage of occupational therapy. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy services, and also a lot of information on private insurance. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. This presentation describes the Florida Medicaid fee-for-service coverage of occupational therapy. Medicaid managed care companies must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation guidelines. MCOs do follow state rules in many cases, but therapists should always double-check payer policies. Please visit Therapy Comply for more detailed information on Medicaid's coverage of outpatient therapy services, fee schedules and code lists, billing for non-covered services, information on qualified Medicare beneficiaries, information on MCO plans, and members can always request information or ask questions about Medicaid coverage and compliance. Occupational therapy services develop, maintain, improve, or restore neuromuscular or sensory motor function to relieve pain, acquire a skill set, or restore a skill set, or control postural deviations. Services must be rendered by either an occupational therapist or an occupational therapy assistant, both licensed in Florida. OTs may supervise occupational therapist students while providing services to a recipient. The OT must direct the care, make all clinical decisions, and be responsible for the recipient's assessment and treatment. The OT must be present for the entire treatment time and may not treat another patient or engage in other tasks while supervising a student. Services for patients under 21 include one initial therapy evaluation per year, one therapy reevaluation every 5 months, up to 14 therapy treatment units per week, so Sunday through Saturday per recipient with a maximum of 4 units per day, and up to 2 casting and strapping applications per day per recipient. As required by federal law, Florida Medicaid provides services to eligible recipients under the age of 21 years. If such services are medically necessary to correct or ameliorate a defect, a condition, or a physical or mental illness. Services for recipients under 21 years exceeding the coverage described within the policy or the associated fee schedule may be approved if medically necessary. And for all patients, including adults, wheelchair evaluations are covered. This includes one initial wheelchair evaluation every 5 years, one follow-up wheelchair evaluation including adjustments and fittings when the wheelchair is delivered, and one follow-up wheelchair evaluation including adjustments and fittings 6 months after the wheelchair has been delivered. Florida Medicaid does not cover the following as part of the service benefit: developing and updating the plan of care, mileage and travel expenses, securing, installing, or maintaining therapy equipment, services not listed in the fee schedule, telephone communications with recipients, their representatives, caregivers, and other providers, except for services rendered in accordance with the Florida Medicaid telemedicine policy, time spent supervising assistants and students, and treatment visits provided on the same day as an evaluation service. Providers must develop and update a recipient's plan of care based on the results of the occupational therapy evaluation. The plan of care must include the following: medical condition, including diagnostic codes, functional limitations, specific therapy to be provided, short and long-term therapeutic goals and objectives, medications, treatments and equipment, treatment frequency, length and duration, therapeutic methods and monitoring criteria, diet as indicated if applicable, means of demonstrating and teaching the recipient, family, and other relevant caregivers, in coordination with other prescribed services. Providers must obtain authorization from the Quality Improvement Organization at least every 180 days or upon a change in the recipient's condition requiring an alteration in services. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe this video. We will be adding many more soon.